New numbers from the CDC show more than 1,000 confirmed measles cases across 31 states, the highest in years. In New York, 5 reported cases, and last week there was a confirmed case at Newark Airport. So what's causing the surge and how concerned should we be? Joining us now to explain is Candace DeMatteis, Vice President of Policy and Advocacy for the Partnership to Fight Infectious Disease. Welcome.
Good morning.
So what's behind the recent spike in measles cases across the country?
Well, the reality is that measles hasn't gone anywhere. And sadly, our immunity has waned because fewer people are getting vaccinated against measles. And that's why we're seeing the spread. It's one of the most infectious viruses we know about. And so there's not enough immunity in the community to stop the spread. That's why we see these outbreaks.
The CDC says 96% of current measles cases involve people who are unvaccinated or have an unknown vaccination status. So why are we seeing such low numbers when it comes to vaccinations?
There's a lot of reasons behind the drop off in vaccinations, but one of the big ones is that they've been so successful that our recent memory of these diseases like measles, notwithstanding the current outbreak, we just don't understand how serious these viruses are, the complications that can arise. 1 in 5 people who develop measles end up in the hospital. And that's something that's not widely known. We have vaccines that are 97% effective at preventing people from getting measles. So there is the opportunity to avoid getting sick.
So how contagious is measles compared to other viruses like COVID or the flu?
A great question. So measles, if you had a room with 10 people in it who did not have, who weren't immune, who weren't vaccinated, and one person walks in with measles, 9 out of those 10 people will develop measles. That's how infectious it is. It is, as I mentioned, one of the most infectious viruses that we know about.
And what are the early warning signs of measles?
It can develop in different ways. It's a respiratory virus, so runny nose, sore throat, that type of thing. Conjunctivitis or pink eye is often an early sign as well. Usually you have the virus and are spreading it for about 4 days before the telltale rash appears. So people can be spreading it without knowing they're even sick. But it can mask itself like many other respiratory viruses until that rash appears, and then that's a pretty evident sign.
And what do you think should be done to address those vaccine concerns that you mentioned?
Well, it's important for people to ask questions. And what we would suggest is there's so much misinformation and just outright falsehoods about measles itself, downplaying the seriousness of the disease, and then also about the MMR vaccine that protects against measles. So what we would suggest is for people to ask their own healthcare provider. If you don't have a regular healthcare provider, go and ask a pharmacist. They're available as well. These are the experts. They know the medical the information behind the diseases. They know about the safety and effectiveness of the vaccines. So if you have questions, go and seek that advice from a medical expert.
Candace DeMatteis, Vice President of Policy and Advocacy for the Partnership to Fight Infectious Disease. Thanks so much for joining us.
Thank you.
Tough news for homebuyers.